Recording now.
All right. So my name is Babette Rothschild. I'm here with Kathrin Stauffer, who's the author of Emotional Neglect and the Adult in Therapy, Lifelong Consequences to a Lack of Early Attachment. We are both authors for W. Norton, and Kathrin's book is out now, and we're going to have a discussion about it. Hi, Kathrin.
Hi, Babette.
So perhaps you could start with telling us about your book and about what emotional neglect encompasses.
Yes, the book is about doing psychotherapy with adults who have a history of emotional neglect in early childhood. So that means perhaps the first 2 years of their lives, they have been perhaps fed and clothed, but not really attended to, not cared for, not perhaps not loved, not wanted, been treated as part of the furniture, really not had their emotional needs fulfilled. So they're often people who've been very unparented early in life, and this will have consequences for the rest of their lives. And sometimes these people then seek psychotherapy.
Can you talk about some of those consequences, how someone as an adult might know that they have been impacted by emotional neglect?
This can be quite difficult. A typical presentation is that the person will say nothing bad happened to me. So we are talking about an absence of something that's really shaped a person. But I think when we look a bit closer, we can say that emotional neglect means that the person's emotional development, which really happens in about the first 2-3 years of life, or the crucial steps of a person's emotional development happen in the first years of life. And there will be gaps in that. So the person may, for example, not learn how to manage stress very well. So they may be quite vulnerable to stress. They may need to lead a life where everything is kept very much on an even keel, and where they don't go for big adventures or big thrill seeking. That may feel very uncomfortable. They may be anxious for a lot of their lives, or they may be depressed. And they often feel that other people are a problem.
Can you describe a couple of scenarios, both ones that might look like trauma and ones that wouldn't look like trauma, that someone might recognize as their background and lead them to suspect that their difficulties lie in emotional neglect?
I mean, there's a lot of overlap between neglect and abuse. So we can sort of assume that a lot of people or most people who've been neglected as children may have also been abused. Certainly people who've been abused as small children, there will probably be a degree of neglect. It's, if your caregivers are abusive towards you, that probably means they don't care much, which is like the definition of neglect. But one or the other will often be dominant. So the kind of, with somebody who has both in their background, they'll be traumatized. And the kind of traumatization that comes from neglect actually looks more like burnout. It's more like a person has had to try and function with not enough resources. They haven't really had the tools for living a good life. And so they've always overstretched themselves. And that we know from grown-ups, this is the kind of thing that leads to burning out. If you're always having to try unsustainably hard to get the result that you want. So this could have been somebody who, wasn't particularly wanted, perhaps got beaten up at times or got sexually abused, but underneath is also a sense that the person hasn't been wanted. They may have known this, they may have known that they were not particularly welcome in their family. If you have a scenario where you can sort of assume that there's a degree of neglect, the very, very common one and very typical one is a mother who was depressed after giving birth. That's, perhaps one of the really common scenarios that will almost certainly lead to a degree of neglect.
I was also thinking about some clients I had whose parents were very busy for whatever reason, whether it was another child who had special needs or their businesses that they were involved in or something like that, that would qualify there.
Absolutely, yes. So if you were, there are also lots of parents who are preoccupied with each other to the exclusion of the children. And I guess a typical way of thinking about neglect would be to think that you were the child that everybody took for granted and who was sort of expected to help out and couldn't really ever say, I'm not all right.
I would think for somebody in those situations, it would be even more difficult to feel like there was some problem in their background because it didn't look like there was.
Oh, absolutely.
They basic needs were met, but emotional needs were not. Yeah.
Yes, and this is in itself is a difficulty because, I do think it's hard to live a life where you're struggling all the time and you don't understand why.
Right.
So I've had clients who've said, I almost wish I'd been abused because then at least I'd know why I am how I am.
Yes, so to be more concrete, more easy to pinpoint.
Yeah.
So what piqued your interest in this topic, motivated you to write about it?
I had, by accident, probably, as these things happened, I had a number of clients all at the same time with this kind of presentation. And where there was an absence of childhood trauma, so neglect was really the main thing. And I got interested in what they all had in common, and interested in observing what they did and how they managed life and what the therapy was like. And then at some point I thought, well, I better read up on this and better learn how to be a good therapist for these clients. And I found that there is not a lot of literature there, specifically for therapists. There's a certain amount of self-help literature, and it's rapidly growing. But for therapists, there really isn't an awful lot out there. And so in the end, I just thought it seems worth sharing the things that I have learned just through my experience.
That really says a lot about your dedication to your clients, that you saw a gap in your skill set and area of knowledge and went to fill that so that you could better help them.
Yes, it's true that I'm very fond of my clients.
That really comes across. I should say to the people listening, and I've known Kathrin for a lot of years, we work together, we're also friends, and your fondness for your clients always comes through when you speak about your work. And that's coming through today as you talk about your book. So who's this book for specifically, and who's going to benefit from it?
The book is written for psychotherapists, counselors, psychologists, anyone in the helping professions who may struggle with clients who've been neglected. Many therapists do. I've been a supervisor for very many years and found that often supervisees struggle with this client group. So that's also an offering of maybe some ideas that might be helpful. I also think there are lay people out there, so people who are not therapists, but who may recognize parts of themselves and who may find that helpful. And not least, in my experience, quite a lot of therapists fall into this group. So, if I said before, if you were the child who was always all right and who was always called upon to just help out, that those people can often turn into therapists later on. So many therapists that I've spoken to actually recognize themselves and find it interesting to read and learn a little bit more about themselves as well.
Often when we've been talking about these kind of clients in your book as you were writing it, you would refer them to ignored children.
Yes.
And I was wondering if you'd like to say a little bit about that.
I think ignored comes closest to what I mean by emotional neglect. So the sense that, you're really just taken as part of the furniture and nobody sort of sees you as a person, and nobody feels that you're precious enough to really look after you and care for you. And so I think ignored is also helpful because it really distinguishes the neglect from either from physical neglect or from abuse. Yeah, if you get abused, you're obviously not ignored. So I think being ignored is a very good way of sort of putting the whole experience into one word.
So how will a therapist recognize a client who's been ignored as a child, or someone interested in reading your book for self-help? How would they self-identify as an ignored child?
So most people who were ignored as children are, on the face of it, look like they're pretty together. They're usually polite and sort of may look quite calm. They may look anxious, but they may look quite calm and like somebody who's out of touch with their feelings. That's often an impression they give to therapists. This person really doesn't know how they feel and they need to be put in touch with their feelings. That can be one presentation. One thing that happens to very many people who were neglected as children or ignored as children is that they don't like being looked at. So to actually be looked at and to be seen is often very uncomfortable. They feel very exposed. And they're nearly always people who will not create any kind of upheaval in their relationship. So they will try and keep the therapeutic relationship on an even keel. They'll try and keep you happy if you're the therapist. But at the same time, therapists will find that nothing much changes. Yeah, they're people who appear to be not very responsive to therapy at all. And often they come across as quite resistant to change. So there's an appeal for you to help. And quite often because they have been unparented as small children, they'll quite often look to the therapist to tell them how to do therapy. Yeah? They won't have a clear program of what they want to do, but they'll wait for the therapist to take the initiative. They're also the clients who, at the start of a session, if the therapist is silent and doesn't say anything, they'll get very anxious about that, because that usually means the therapist is angry with them. So they won't like silence at the beginning of a session. But then, although they look to the therapist to sort of do and organize the therapy, as it were, when the therapist comes out with something, they'll often bat it off and say, no, this doesn't work, or we can't do that, or for all sorts of reasons. And that can be very frustrating for therapists.
I was just thinking that it sounds like working with ignored children, that a therapist needs a flexibility and a patience that they may not have been taught or had experience with in their education or their practice, because we're sort of taught to let the client, begin, and if they don't, they're being resistant, and that's bad,
Yeah.
and kind of thing. And what you're saying is that's standard for a client in this category, and that rather than confrontation, they need support in a way that we might not normally think of supporting clients.
Yes, I think that's a very fair comment. Challenges and confrontations very rarely work with ignored or people who've been ignored children, mostly because their attachment relationships are so insecure. They feel so unsafe in the world, basically. That is sort of one of the bottom lines. And the other bottom line is that they feel terribly ashamed of themselves. So if you challenge, it almost invariably feels shaming. It's very, very difficult to challenge in a way that the client doesn't end up feeling really, really humiliated. And then it's not going to go anywhere. And, I think in a way, if you think about it, you can understand what's happening, because these are people who haven't learned that other people can help. That is a missing experience in their lives, that you can, if you have a difficulty, you reach out to somebody and they help, and you can gain a confidence in your ability to do that. You have an ability to engage people in a way that is collaborative or that makes them help you. These are experiences that the people who were ignored children have not had, and they have very, very profound effect. So the client effectively doesn't know how to make use of the therapist. And for therapists in the counter-transference, this can very easily feel like, whoa, I'm really de-skilled here, and what I do is really pointless, and we're not going anywhere.
But what I've noticed in that situation, both with myself and with people I'm supervising, is that it can feel frustrating and like things aren't going anywhere, but the client keeps coming back.
Yeah, always.
And,
yes.
And what does that tell you?
Yes. So the clients will, these are clients who really like to come back. The regular rhythm of therapy suits these people. They're people who like a regular and ordered life. And they're also people who generally experience themselves as having very, very few things in life. And that's both external things often and internal resources. They have very, very few, and they have usually few relationships. And they really cannot afford to lose any. So they will really hold on very fast to relationship, including the therapeutic relationship and including the therapy. For as long as they think you can bear them, they'll keep coming.
That puts a different spin, which is so important. Can you give us a little teaser of an intervention or a scenario and how you approached it that you describe in your book?
Well, if we take the topic we've just been talking about, where you have a client where you're working very hard and you sort of think nothing's happening and they're resisting, so you want to confront that. Instead of confronting, the question always comes, what do you do instead? And I guess what I would certainly do is I would try and do a little bit more of what I might call the relationship work. So instead of asking the client what's wrong, I would try and make a guess and then make a suggestion and see whether the client is able to pick it up. So if the client keeps saying, whatever I suggest isn't working, I might try, I might feed back something like, gosh, it really feels like I'm just not getting you here. Or I wonder if actually the thought of changing makes you feel very anxious, that you might not quite know who you are when you change, something like that.
Wow, so that's rather than confronting them and saying you should be doing something differently, you're actually recognizing, seeing the difficulty that they're having and reflecting them back to them.
Yeah.
And taking some responsibility for it. It's not many therapists who will say to a client, it seems like I'm not getting you. Usually the therapist is saying, you're not getting me.
Gosh, yes. Well, I guess I see it as my job to get the client. And if, so I think it's sort of a prerequisite for being able to work well. And I think in my experience, people who were ignored children actually really respond well to having a therapist who doesn't just sit on a high horse and as they would see it, and doesn't just say, well, here's what I've got to offer, take it or leave it, but who actually really sort of is on site and who is able to take it seriously, that they're not being uncooperative out of bloody mindedness, but actually they don't, they have a serious reason for not being cooperative.
Right. It's a very lovely level of compassion also for this particular difficulty, so that I can imagine for a client who's been ignored, for the therapist to actually see them and recognize that this is hard for them and support them in that rather than confronting it, could be a life changer.
I'm hoping that it would be, yes. One of my clients once said to me, the thing that's helped me most is that you never blamed me. So
I'm wondering if I'm just thinking right now of a client. I probably had more situations than this, but one in particular stands out to me, of a client like this, who's probably like this, where I made the exact wrong intervention.
Yeah.
Would you mind if I shared it?
No, go for it.
This kind of client that you described, that every time they come, things are difficult. And the client, every time they came, would say, I don't want to be here. This is hard. I don't want to be here. I don't want to be here. Every time they came. And this was earlier in my career, and I was less well-grounded and knowledgeable and patient than I am now, or grew to be. But anyway, she came in one day and said again, I don't want to be here. And for whatever reason, it's hit me in the wrong spot. And I said, I guess I thought I was being supportive. I said, well, you do keep coming. So you must keep coming for a reason. It was like a confrontation.
Yeah.
She never showed up again.
Really? Gosh. So she felt too shamed by that.
Shamed. Yeah.
And I think it's a good example, because often we can shame a person who's been an ignored child with an intervention that doesn't feel shaming to us. Yeah, there's nothing wrong with this intervention, basically. Or with another client, it could be fine. With this client, it's just too much.
Right.
I think it's very bad luck that your client didn't come back at all, so you never had the chance saying, "Oh, I'm so sorry, I said the wrong thing," and then it might have been possible to carry on.
I'm sorry you weren't my supervisor at that time. I wasn't prepared for it. But so that's really, among other things, a service that you're doing with this book for the therapists and the clients, is helping prepare therapists for taking a different view and a different angle with clients in this category.
Yes.
Which I think is a terrific thing.
I'm hoping to do that, yeah.
What else would you like people to know about the book before we close our discussion?
So I guess the way I've been speaking now gives perhaps a flavor of that. I think it's actually very important for therapists to sort of put themselves in the client's place and have a good idea of what it's like to suffer from this. So that's a chunk of the book. describes the subjective experience of clients who have been ignored children. There's a chunk which describes theoretical ways of thinking about it, both from psychotherapeutic theories and also from neuroscientific considerations. There's quite a lot about the sort of emotional self-regulation that doesn't work very well for these people. And then there's a chunk which is about concrete intervention. So there is a chapter which is more about the relational aspects of working with these people. And then there's a chapter with specific interventions that I have found useful. So that's how the book is organized. I've tried to cover as much material as I knew. And I hope it will make it readable.
I think that sounds fantastic, Kathrin. I think it's a terrific book. Why don't you show the cover too? Nope, that's us.
There you are.
There you go. Emotional neglect and the adult in therapy, lifelong consequences to a lack of early attunement, Kathrin Stauffer. Anything else before we stop here, Kathrin?
I think you've been a terrific interviewer. Thank you very much, Babette.
Terrific interviewee. Really lovely talking with you.
Okay.
We'll say bye for now.
Bye-bye.